Welcome to Adapt NCLEX. NCLEX, passing and failing depend on what you do in the first 20 questions and 25. Why? Because it's an adaptive test. Every adaptive test, the first 20 to 25 questions will determine your fate. If these were the 20 questions that you saw, what will you do? Test yourself. Let's go. First question. A nurse is working in the mental health clinic is reviewing telephone messages from client. Which of the following clients should the nurse return the phone call to first? Prioritization question. You got to be sharp. A client taking clozapine report what? Drooling. 2. A client taking Zapraxidone will report what? Fainting spell. A client taking Prospiridone will report an inner feeling of restlessness, and a client taking quetiapine will report fever. This is what? Psych pharmacology in prioritization question. That tells you it's an I-yield fact. They're taking psych, now it's a prioritization. At the same time, pharmacology. These are questions, when you see it, it's a passing level question. What do you think? Pause the video, answer the question on your own, and see the way I'm going to approach it. You get your answer? What do you think? Which was your answer? First, break down the question and figure out what is going. This is the way I do prioritization. Look at the first situation. Clozapine, I have drooling. Zapraxidone, I have fainting spell. Respiridone, I have inner feeling of restlessness. Quetiapine and fever. Ask yourself, is this side effect expected? If it's expected, ignore it. Sometimes it's expected, but it's a bad expected finding. And if not, you got to be sharp and pick your answer. Therefore, clozapine, is he okay with drooling? Zapraxidone, is he okay with fainting spell? Respiridone, is he okay of having inner feeling of restlessness? And quetiapine, having fever. What do you think? I can tell you, all these are side effects associated with what? Antipsychotic. All of them are antipsychotic. But the major and very important side effect is neuroleptic malignant syndrome. And what is that? Quetiapine and fever. This is your right answer. The others are expected finding that we have time to deal with. Respiridone is a second-generation antipsychotic. Inner feeling of restlessness is akathisia. We have time. It's EPS, extrapyramidal syndrome, right? Zapraxidone, of course, you have QT prolongation. You can have fainting spell, but fainting spell is not compared to NMS. NMS is more dangerous. And clozapine, you're going to have drooling. It's a trap. They have hypersalivation. This is not airway issue. Know this, write it down, and next time, don't make that mistake if you pick the answer choice. So D is your right answer. And this is the questions I use for my Q-Bank, for my crash course, and then on-demand course. And this is caring for a newborn whose parent what? Had what? Rubella during pregnancy. That's key, right? And it said what? Which of the following conditions should the nurse anticipate in the newborn? Select or that apply. Cataract, sensorineural hearing loss, patent ductal arteriosus, neurotube defect, microcephaly, strawberry, blueberry fin rash. There's a concept there. The key concept is rubella. There's certain side effect you have to know about rubella. You don't have to pick everything. It's a select or apply. Don't over-select. Pick your answer, let me know. But if you don't pick at all, remember these 3 C's. Rubella, when you see rubella, what is the side effect on the kid? 3 C's. They're going to have cataract. Cardiac side effect, therefore patent ductal arteriosus. What is the other C? What do you think? Hearing problem, right? This is your hearing. It's a cochlear hearing problem, right? Defect associated with your cochlea. What is the other C? Defect associated with your cochleas, therefore hearing problem. Neurotube defect, you know, is not associated with rubella. Neurotube defect is a trap. It's due to what? Folate deficiency. The kid's head will be small, microcephaly, and they have specific rash called strawberry, blueberry, muffin rash. If you don't know, ignore it. But this is also the answer. But if you don't, at least 3, get 3 out of 5. Don't overselect. And so know them, remember them when you see rubella infection. A nurse is made aware of 4 clients. Which of the following clients should the nurse assess first? Once again, risk reduction, prioritization is big for the NCLEX. This is what it is. A client who is 24-hour post-operative following a colostomy with beefy red stomach. A client who is 4-hour post-cardiac catheterization, positioned at 45 degrees. A client with diabetes who is 4 hours after receiving insulin glycogen. A client with diverticulitis who report left quadrant abdominal pain. The best way to do prioritization is to step back, look at the answers, see if it's interconnected, and you got to be sharp. Breathing, electrolyte shock, sepsis, airway, right? Lactagy, be sharp. Check my channel and you will learn about be sharp regarding prioritization, and then connect them. If it's suspected, ignore it. If not, pick it. Sometimes you can have expected finding, but it's bad. Therefore, let's get to it. 24-hour colostomy, should I expect it to be beefy red? 4-hour cardiac catheterization, should you be positioned 45 degrees? What is the best position? Ask yourself. If I have diabetes, 4 hours ago, I received glycogen, what would I do? And then diverticulitis, should I expect left lower quadrant pain? That's all. And you pick your answer, you pause your video, that this is bad. Bleeding is supposed to remain supine. The leg has to be flat for at least 6 hours. Colostomy is going to be beefy red, expected finding. Glycogen is a long-acting. You don't need to check anything. Therefore, ignore it. Definition of diverticulitis is having left lower quadrant pain. Ignore it. There's no fever. There's no sepsis. Ignore it. So that's our right answer. So you can see everything is interconnected. Therefore, B is our right answer. A registered nurse and a UAP provide care for a client in a high clinic. Which tasks the nurse should safely delegate to the UAP? Anything that does not require thinking, anything that does not require thinking, anything that does not require thinking, and ADL. That's all. It does not mean what they do does not require thinking, but when you're answering questions, that's the way to narrow things down. Reinforcing teaching on the side effect of a prescribed high drops, assess for high irritation, perform Snelling chart test, provide teaching on proper use of contact lens. Think about it. Which one does not require thinking? Well, I'm going to examine your eye. That's all. The rest, I got to teach you, I got to provide education, and I got to assess you. All of them done by the RN. The nurse is working in a clinic, is reviewing telephone message for 4 clients, prioritization, risk reduction. Key, which of the following clients should the nurse return the phone call first? Well, I got to talk to you, otherwise you're going to get into trouble. Reducing your risks. A client taking phenotime, pharmacology, who report swollen gum and dizziness. A client taking methotrexate, who report mouth sore and low-grade fever. A client taking clozapine, who report fatigue and sore throat. And a client taking sildenafil, who report a mild headache after use. If you need pharmacology, I have a bunch of pharmacological series that will teach you which pharmacological medication, the major side effect you should worry, and expected finding associated with this medication. And this is what the prioritization is asking you. You pick your answer? Number 5. What is your score so far? You pick your answer? I hope so. You can see clozapine, antipsychotic with fever and sore throat, agranulocytosis, right? Sore throat is fever. It's a form of infection. And because it causes agranulocytosis, it can lead to NMS. Well, the major side effect, as you can see, is bad. Sildenafil causes what? Vasodilation. You're going to get headache. Methotrexate, you're going to have mouth sore and low-grade fever. That's still not bad compared to agranulocytosis. These are things you have to compare. And a client taking phenotime is going to have what? Gingival hyperplasia. This is what you have. And this is assessing a 7-year-old client who has tonsillitis. That means infection of the tonsil. Break down the question. Now analyze it. Which finding will require immediate follow-up? I see immediate follow-up. I know I'm doing prioritization, risk reduction, prioritizing the patient. If you have tonsillitis, difficulty swallowing. If you have sore throat before, think about it. Are you able to swallow easily? Do you see a large swollen lymph node and your temperature goes up if you have tonsillitis? Do you see a muffled hot potato voice when you have tonsillitis, and is it bad? Do you see a red, beefy, red strawberry tongue? These are things you think about it. I've had sore throat. I have tonsillitis before. Or sore throat friend, sore throat like tonsillitis. But it's almost the same, except this is a rare infection of the tonsil. Which one of these do you think is more important to intervene right away. You won't be able to swallow. That's not airway problem. Don't fall for it. It's a trap. Your lymph node is going to get bigger, expected finding. Hot potato voice, that means that's the true airway, because now you have something we call trismus. It's basically the inner portion of the throat is getting involved. And that's when you have to intervene. Beefy red and strawberry tongue is expected finding. And this is caring for a 9-year-old client diagnosed with varicella infection, right? Airborne and the contact precaution. The nurse is providing district teaching to the parent. Which of the following instructions should the nurse include? Select or apply. Varicella, diagnose. What do you teach? Keep the child home until all lesions are crusted. Is it appropriate? Administer aspirin or acetaminophen for fever. Trim the child's fingernail. Contact the school to report child's illness. Use calamine lotion to reduce itching. Encourage the client to scratch the lesion to relieve discomfort. The questions say what? Which instruction should the nurse include? It means appropriate teaching, underlines it. So which one is appropriate to give to this kid who has varicella infection? I don't want the infection to spread. Therefore, keep the kid at home until you have crushed it. And when it's crushed it, it can take 10 to 14 days, then we're good. Aspirin or acetaminophen is a trap, right? You can give them acetaminophen, but no aspirin. So there's no two options. Away, it's a viral infection in the kid, no what? Aspirin. But you can get acetaminophen. Therefore, it cannot be all. It has to be one. Wrong. Trim the child's fingernail so that they don't scratch and spread the infection. You need to contact the school. It itches and you're uncomfortable, so you wash them with calamine lotion to reduce itchiness. They should not scratch the lesion to relieve the discomfort, right? That's why you're trimming their nail. Therefore, don't pick F. It's interconnected. And then she's preparing to administer a rectal suppository to a client. What is the test? What is the concept? What is being tested? How to give suppository. What are the key? That's the key. As every question has a concept. What is the number one thing you want to avoid? Rectal perforation. So how do you avoid it? First, know the position and how to avoid rectal perforation. Which of the following should the nurse take? Action to take. Position the client in the supine position. Insert the suppository past the external anal sphincter. Instruct the client to remain in same position for at least 5 minutes after the insertion. Ask the client to bear down during insertion. Which one is appropriate? Rectal perforation means you should not pass the internal sphincter, not the what? External sphincter. You should remain within the internal sphincter. Therefore, past the external sphincter is too high. Remain in that position. Supine, no. Same position, you should not bear down. So C is the right answer. And this is caring for a client who is prescribed spironolactone. Ask yourself, what is spironolactone? What does it do? What is the side effect? Analyze the question. Spend time, 5 seconds, break down the question, figure out what is being asked. Which of the following medication are contraindicated? Therefore, I know spironolactone. What does it do? What is the side effect? Therefore, what is contraindicated? The major side effect associated is what? Then use that to answer the question. Lisinopril, furosemide, metoprolol, amlodipine, irbesartan, aliskiren, and heparin. Which one? First, you ask yourself, what is spironolactone? Then if you know, the rest is history. It's a potassium sparing. If you have too much potassium, I'm not going to take it. Lisinopril causes what? High potassium. Therefore, you can take it. Furosemide decreases your potassium. Metoprolol does not affect your potassium. Amlodipine is a calcium channel blocker. You see, pharmacology. Satan, I call them the Satan, ARB, is the same thing as what? ACE inhibitor, increases your potassium. Aliskiren is basically what? A direct renin, that also increases your potassium. And the last one, even if you don't know, heparin, just leave it, also can affect your potassium. But at least I expect you to answer at least 3 points out of this. You can leave the heparin alone. You don't have to pick anything you don't know. Pick those that you're 100% confident. But A nurse manager is assessing seizure care with nurse on the unit. Which of the following statement by the nurse indicate the need for further teaching? That means they don't know how to manage a patient in seizure. This is a trap. Don't select the answer. Pay attention to the question and the words in the question before you pick it. I will turn the client to the side during the seizure. I will loosen restrictive clothing around the client's neck. I will note the duration of the seizure. I will go to the nurse station for assistance. It's a trap. Watch the answers and see which one is a trap. Patient is having seizure. What action you take that require need for further teaching? What do you think? Of course, put them on their side so that they don't have aspiration. Any restrictive clothing, lose it. Then know how long the duration of the seizure so that, yeah, if it's more than 5 minutes, you know they're on status epilepticus. And therefore, thus, you should never leave the patient alone, even though it look like it's good thing. Go and call for help. You can scream for help, ring alarm bell, but leaving the patient to go call for somebody and the patient is having seizure, it's a wrong thing. D is a trap. 10. What is your score so far? Put it in the comment. And if this video helped you, give us a thumbs up. Just write a small comment. And if you're not subscribed, subscribe for more content like that. And if you want more, you can join Adapting Class Crash Course that is coming up. Check my website or the channel and you see the information. And then she's teaching the client about what? Advanced directives. Which of the following statement indicate the need for further teaching? Select or apply. When you're taking the NCLEX and you saw this advanced directive, if they don't say a living will or power of attorney, answer choice apply. That's a trap. It's a two things in one. Advanced directives can be power of attorney or a living will. Therefore, what? I can designate someone to make a decision if I became unable to. Once I complete an advanced directive, I can't change it. My advanced directive goes into effect only if I'm unable to speak to myself. I should give a copy of my advanced directive to my healthcare provider. Advanced directives are only for people who are dying. Which one need further teaching? That's all. What do you think? Yes, you can designate somebody to do that. That's power of attorney. You can change it. Even the last minute, you can change it. So that's wrong. Look, the advanced directives, pay attention. This is a trap, right? 11, right? Look at it. My advanced directive goes into effect if I'm unable to speak for myself yet, because it's a living will, you're still alive, you can make a decision. And when you designate somebody until you can't do that anymore, I should give a copy to your advanced directive to healthcare provider so that they know what to do in case you can't do anything. They are not for people who are dying. Even if you don't do dying, you can do that. That's what we call it advanced. You want to make a decision before you die or you're about to die. Therefore, E is the wrong answer. And this is caring for a client in labor who has intrauterine pressure catheter in place. This is a new information the NCLEX start asking devices, especially this. This is what they put in their new test plan. Intrauterine pressure catheter in place. Which of the following indicate the function of that? The answer choice is the meaning of the instrument. That's all. Every time they give you instrument question, the answer choice is in the question itself. They will describe it, pick it, and use it. Continuous fetal heart rate monitoring. The monitor shows variability in fetal heart rate. The client report increased perception of contraction. The monitor provide quantitative measurement of the uterine contraction. I said what? Intrauterine pressure catheter, right? That means it's going to measure pressure inside the uterus. Which answer choice? You talk about the uterus, talk about the pressure, and how do you measure pressure in the uterus? Contraction. Therefore, you know, this here contraction, but it said perception is wrong. We're measuring, therefore provide quantitative measurement of that pressure is that. A client with type 2 diabetes presents to the emergency room with severe indigestion, fatigue, and shortness of breath. The client denied chest pain. Which of the following is the most likely what the client is experiencing? The keyword is diabetes. Diabetes patient with signs and symptoms of shortness, indigestion, and fatigue. What do you think? Is it GERD, panic attack, MI, or pulmonary embolism? You know it's not GERD because diabetes patients present atypically. Just because they have indigestion doesn't mean that's chest pain, MI. Panic attack, I will tell you heart rate is going up. Pulmonary embolism, I will tell you about saturation. I never tell you anything. And this is caring for a client who has systemic lupus. What is the major complication associated with this? Which of the following findings should the nurse identify as the highest priority? Fatigue and low-grade fever, butterfly rash across the cheek, proteinuria and hematuria, joint pain and stiffness. There's one thing, whenever you hear lupus, you should remember it affects every organ system. But when you see one thing, you know patient is in trouble. It's the highest priority. You're going to have fatigue and low-grade fever. It's fine. Butterfly rash is always common in their face. But when the kidney is in trouble, it's bad. You're going to have joint pain, stiffness. The presence of kidney deficiency, that's about to have major problem. Floating nurse, you have to know what they do. When they move to another nurse station, what can you assign to them? The floater, who is orthopedic nurse, is assigned to the med search due to nurse shortage. Which of the following assignment is appropriate? Key fact. Well, if you are orthopedic nurse, I'm going to give you something that will be orthopedic related, or any general nurse can do that. Therefore, which patient? A client with new diagnosis of diabetic ketoacidosis receiving IV insulin infusion, a client with acute chest pain awaiting cardiac enzyme results, a client with pulmonary embolism receiving thrombolytic infusion, a client 6 hours post-operative following a removal of appendix. Who is safe? Who is basically any nurse can take care of, because this orthopedic nurse, she take care of bone. There's no bone here, but which one can she take care of? DK, no. Arrhythmia, cardiac problem, no. Embolism, no. Appendicitis, post-op, they can give them medication and it will be fine. Predictable outcome. And let's provide care for a client receiving IV erythromycin. Its antibiotic is called macrolide, which action by the nurse is a priority. The NCLEX love macrolide because of major side effect. Obtain liver enzymes, cardiac monitoring, provide them with ondansetron to treat anticipated nausea, monitor their blood cells. Key, macrolide, QT prolongation, macrolide, QT prolongation. Therefore, if QT prolongation, cardiac monitoring. If you give them ondansetron also causes QT prolongation. They're going to go into cardiac arrest. Therefore, don't forget this antibiotic. A client with urinary tract infection is prescribed what? Phenazopyridine, which teaching is appropriate when caring for the nurse, when caring by the nurse. The medication will kill the bacteria causing the infection. This will treat the pain and burning associated with the infection. Wear eyeglasses during the duration of the prescription. Apply sanitary napkins in your underwear. Expect bright red, orange urine discoloration. This is a very common traffic question. Phenazopyridine, a lot of people make mistakes. There's misconception associated with that. What do you think? What are you going to teach them appropriately? It's no antibiotic, it's just a pain. So help with the spasm, right? It will take pain and burning associated with the infection, but not the infection. It causes your secretion to change colors. Therefore, glasses, no contact. You got to have napkin and something under your underwear so that it doesn't stain it. And then your urine is going to change in color. Teach the patient this information. And this is aware of several clients on respective prescribed medication. Which drug combination is bad? You got to question it. That means you should not put them together. Select which one you think. You don't have to select everything. Pick those you're 100% confident. If you take furosemide, should you take ibuprofen? If you take lithium, should you take chlorothalidone? If you take digoxin, do you take furosemide? If you take allopurinol, do you take benstropine? Spironolactone, do you take salt substitute? What do you think? I can tell you, spironolactone spare potassium. Salt substitute, there's no sodium. That means there's too much potassium. Wrong answer. Allopurinol, you're going to get NMS or what? EPS. Therefore, we give you benstropine to prevent that. Digoxin, you know about your potassium, and therefore, furosemide is a bad thing. Lithium, also dehydration is a major problem. Chlorothalidone is a hydrochlorothiazide derivative, dehydration. bad. It also affects your sodium. Furosemide and ibuprofen, bad combination. Ibuprofen, what is that? Water retention. Furosemide, we're trying to get water out of you. Therefore, they counteract each other. Bad medication, bad combination. This is all pharmacology all over it. If you need, check Adaptive NCLEX. You'll see a bunch of them pharmacology questions and you master them. And the 2 questions, what is your score so far? Let me know what you're thinking. A client reports what? Right lower quadrant pain, fever, anorexia, nausea for 24 hours. Which assessment finding is concerning? What do you think? What does that sound? What is the diagnosis? When do you have pain on your right lower quadrant, fever, anorexia? This will help you with case study. Sudden relief of pain, is it bad? Pain worsening at the McBurney's point, fever 101.5 and anorexia. Which of this is bad when you have what? These kind of symptoms. Fever, anorexia, right lower quadrant pain is appendicitis. Appendicitis, if the pain goes away all of a sudden, bad problem. We can still give you pain medication. People think you cannot give you pain medication. You still receive pain medication. But if it's true appendicitis, the pain never go. It's just coming down. Therefore, sudden onset. All this is the signs and symptoms of appendicitis. 20 question. How do you do? And then provide care for a client receiving fluphenazine for 4 days. Client report for temperature is 104 and diaphoresis and irritable. Which action is a priority? This is 2nd generation antipsychotic, and you have fever, sweaty, and your temperature is going up and irritable. What should you do? Should you decrease the dose? Should you give them dantrolene to treat it? Do you give them cyproheptadine as prescribed, or continue to monitor their vitals every 15 minutes? This is what the NCLEX will do to you. 20 question. This is NMS. You should stop the medication all over. But there's no, it said decrease it. Still wrong. Stop it. Treat it with dantrolene. That's the best answer. Cyproheptadine is used for what? Serotonin medication. So like SSRI. Don't check their vitals anymore. Adaptive test. 20 question. If these were your 20 question, how would you do? Would you be above the passing level or below or at the passing level? Judge yourself. Let me know in the comment section. Take care of yourself and good luck in your exams.